organizations. Hospital. Hospital is an integral part of a social and medical organization, the functions of which are to provide the population complete health care, both curative and preventive. The main objective of the hospital is to provide adequate care and treatment to its patients. Modern hospitals are very complex socio-economic, scientific, and highly labor-oriented organization. A hospital is different from a dispensary because a dispensary is a place or room where something is dispensed, while hospital is a building designed to diagnose and treat the sick, injured, or dying. Usually has a staff of doctors and nurses to aid in the treatment of patients. Classifications of the hospital. According to ownership, according to scope of services, according to length of stay, according to bed capacity, and according to levels of services. According to ownership, a government and a private. In government hospital, it is a hospital which is a government owned and is fully funded by the government, like see Philippine General Hospital. While in private hospital, it is owned and established and operated with funds through donation, principal, investment, or other means by any individual, corporation, association, or organization, like St. Luke's Hospital. And according to scope of services, general and specialty. When you say general, it is a hospital that provides services for all kinds of illnesses, disease, injuries, or deformities. It provides medical and surgical care to the sick and injured, maternity, newborn, and child care. Specialty hospital. When you say specialty, it is offer focused services to treat medical conditions that require a particular subset of skills and technology. Treatment of particular type of illnesses. Treatment of patients suffering from disease of a particular organs or groups of organs. According to length of stay, short term and long term. When you say short term, it is less than 30 days. Acute cases. Acute conditions are severe and sudden in onset. Long term, it is more than or equal to 30 days. It is chronic cases. A chronic condition is a human health condition or disease that is persistent or otherwise long lasting in its effect, or a disease that comes with time. According to bed capacity, large, medium, small. Large hospital, it is more than 500 beds, like in Makati Med, St. Luke's. Medium, between 200 to 500, like in Riverside Medical Center Incorporated. Small hospital, it is less than 200, like in Bago City Hospital. According to levels of services, first contact with hospital personnel that checks patient into hospital. Billing and collection departments responsible for billing patients for services rendered. Medical records responsible for maintaining copies of all patient records. Information system responsible for computers and hospital network. Medical social service or health education responsible for staff and patient health related education. Human resources responsible for recruiting or hiring employees and employee benefits. Therapeutic services physical therapy, occupational therapy, speech or language pathology, respiratory therapy, medical psychology, social services, pharmacy, dietary, sports medicine, and nursing. Physical therapy, or what we call PT. They provide treatment to improve large muscle mobility and prevent or limit permanent disability. Treatment may include exercise, massage, hydrotherapy, ultrasound, electrical stimulation, and heat application. Occupational therapy, or OT. Treatment is to help patients regain fine motor skills so they can function independently at home and work. Treatments may include arts and crafts that help with hand-eye coordination. Speech or language pathology. They identify or evaluate and treat patients with speech and language disorders. They also help patients cope with problems created by speech impairments. Respiratory therapy. They treat patients with heart and lungs disease. Treatment might include oxygen medications, breathing exercises. Medical psychology, concerned with mental well-being of patients. Treatment might include talk therapy, behavior modification, muscle relaxation, medications, group therapy, recreational therapies like art, music, and dance. Social services. They aids patients by referring them to community resources for living assistance. Social worker specialties includes child welfare, geriatrics, family, correctional. Pharmacy. They dispense medication per written orders of physician, dentist, etc. They also provide information on drugs and correct ways to use them while ensuring drug compatibility. Dietary, responsible for helping patients maintain nutritionally sound diet. Sports medicine provide rehabilitative services to athletes and teaches proper nutrition. They prescribe exercise to increase strength and flexibility or correct weakness. They apply tape or padding to protect body parts and administer first aid for sports injuries. Nursing, they provide care for patients as directed by physicians. Many nursing specialties include nurse practitioner, labor and delivery, neonatal nurse,
Pharmacy.
emergency room. Divisions of hospital pharmacy is administrative services. It plan and coordinate department activities. Education and training coordinates programs for undergraduate and graduate pharmacy students. Pharmaceutical research develop new formulations of drugs, especially dosage forms not commercially available of research drugs. Inpatient services provide medications for all inpatients of the hospital on a 24-hour per day basis. Outpatient services compound and dispense outpatient prescription. Drug information services provide drug information on drug and drug therapy to doctors, nurses, medical and nursing students, and the house staff. Departmental services control and dispense for fluids. Purchasing and inventory control maintain drug inventory control. Central Supply Services it develop and coordinate distribution of medical supplies and irrigating fluids. Assay and quality control perform analysis on products manufactured and purchased. Manufacturing and packaging manufacture wide variety of items in common use at the hospital. Material products produce small volume parenterals. Radiopharmaceutical services centralize the procurement, storage, and dispensing of radioisotopes used in clinical practice. Four admixture. Centralize the preparation of four solution admixture. Module 3, Topic 3. Centralized and decentralized pharmacy. Centralized pharmacy. The pharmacy processes orders for medications and sends the day's meds to the patient care areas. Advantage of centralized services: fewer system, complete floor stock system, combination of 1 and 2, the unit dose method. Individual prescription order system used by the small and or private hospital. And disadvantage of this system and advantages of this system. And disadvantages: possible delay in obtaining the medication, increase in cost to the patient, and the advantages of the system is the nursing unit ready for immediate use, charge floor stock drugs, medications that are stocked on the nursing station, group of medications that are placed at the nursing station at all times and for which a charge is made to the patient based on individual utilization. Free floor stock or non-charge floor stock, predetermined system, and complete floor stock system utilizes the individual prescription order system as primary means of dispensing. At the same time, maintains a limited floor stock. Disadvantages of combination system: time consuming, more personnel required, and increased cost patient. Unit dose system: those medications which are ordered, packaged, handled, administered, and charged in multiples of single dose units containing a predetermined amount of drugs are supplied sufficient with clear instructions, advice, and counseling where necessary on the use of those medicines. The pharmacist should ensure that the dispensing process implemented in the pharmacy implies the correct attitude and transfer of knowledge from reading the prescription to the handing over of the medicine to the patient. Dispensing process: communication and interaction between the patient and the pharmacist. It influences the efficacy of the dispensing process, eliminates dispensing errors. Category of medication error. Category A stands for alang error. Category B, buti na lang. Category C, chamba. Category D, dagdag monitoring. Category E, needed intervention. Category F, prolonged hospitalization. Category G, grabe permanente. Category H, halaka. Category I, patay. Terminologies for medication error. Potential error, prescribing error, and omission error. The potential error is a mistake in prescribing, while prescribing error is an incorrect selection of dose. Omission error is a failure to administer an ordered dose before next scheduled dose. Wrong time error, unauthorized drug error, improper dose error. Wrong time error is an administration of medication outside the interval. Unauthorized drug error is an administration of medicine not authorized by a legitimate prescriber. Improper dose error is an administration of a dose greater or less than the other amount. Wrong dosage form error is an administration of different dosage form. Wrong drug preparation error is when drug incorrectly formulated or manipulated. Wrong administration technique error is when inappropriate procedure in administration. Deteriorated drug error is an administration of expired drugs. Monitoring error is when failure to review the prescribed regimen and assess patient response. Compliance error refers to inappropriate patient behavior. Other medication error is an error that does not fall into above categories.